The overview of parvovirus. Parvovirus is an infection that dogs, mostly in puppies from ages 6 to 20 weeks old, can get. There are two forms of parvovirus, which are the intestinal form and the cardiac form. This illness is contagious as it is a viral illness. It spreads by direct contact with an infected stool, environment, or person. The signs and symptoms of parvovirus is, for the intestinal form, there are symptoms of vomiting, bloody diarrhea, weight loss, anorexia, fever, and lack of appetite. This form attacks the body's ability to absorb nutrients and cause a dog to become dehydrated and unhealthy very quickly because of the lack of fluids and nutrients. The infected dog's heart rate will increase and the body temperature will decrease. Eyes and mouth might appear red and the abdomen will appear sore. For the diagnostic testing, the vet will do an initial exam. If the clinic symptoms are showing, then a parvovirus test will be performed to properly diagnose this puppy. A blood test will be performed and a fecal flotation test to determine if this puppy has contracted this illness.
Hi, I'm here for an appointment for Joey, my dog, Rottweiler.
Yes. Welcome to the Durham College Veterinary Hospital. I'm sorry to hear Joey's not feeling well. Have a seat, let me pull up his information.
Okay, thank you.
Oh, look here, I see this is your first time with us. Let's work together to get some information on this guy. Can you fill out this form for me, just so I have all your new client information, because we are organized and because it is legally required?
Yep, thank you. Do you have a pen by any chance?
No, but I do have a pencil crayon.
That'll work, yes.
This is the client information that I have to fill out so that the clinic knows my information and how to contact me and my emergency contact in regards to our animal.
Okay. Oh, look. Here we have the information you gave us on the phone. Uh-oh. Joey's been puking a lot? That's not good. Let me bring you to a room and the vet will be in to do some tests soon.
Thank you. I've been very worried about him. He's been very ill.
Hey, Joey's here for his appointment.
Oh, what? Oh, hello.
Hi.
I'm the vet tech. I will be doing Joey's physical exam, and then I'll give my information to the vet.
Sounds great. He's a bit wriggly.
This is the physical form. At the top of the paper, it has the client's and patient's information. It explains what the owner has witnessed Joey going through, like the vomiting and diarrhea. It's a record of the patient's physical status from the initial exam performed by me, the RVT. We can tell Joey isn't feeling well because of TPR. He's also showing signs of parvo, like dehydration, fever, V/D, loss of appetite, and he's weak. It explains the assessment of Joey and the findings, which are he is losing weight, has a fever, sensitive abdomen, he is dehydrated and vomiting and diarrhea, and the treatment plan that will be done to help Joey recover. We will perform a SNAP test and blood test to determine if Joey has parvovirus. Also, we will give him IV fluids to help hydrate him.
Hello, I'm the vet and I have some information. I would like to keep Joey for some tests. We suspect he has parvovirus, and if that is the case, we are going to keep him here for a few days. Parvovirus is very serious. Vomiting and bloody diarrhea are some of the main symptoms which Joey does have. We'll do a quick test that will diagnose or rule out, and we will go from there.
Is it fatal? Is he gonna be okay?
It can be, but with the right treatment and care, he will recover in no time.
On the patient label that the clinic creates, we use the client information and the patient information, including the name, breed, color, gender, birthday, weight, and age. The results for Joey's tests are that he is positive for parvovirus, which is determined by using the SNAP test. And the blood test confirms that his white blood cell count is low, which is also a sign of parvovirus.
Look at this. We have diagnosed Joey with parvo after these tests, all of which we kept recorded here. Now is the time we come up with a treatment plan and an estimate for the pet's parents so they will know how much it costs for Joey's treatment.
Okay. For treatment, the parvovirus needs to be treated quickly before it becomes more serious. If the dog has vomiting and diarrhea, it will need some anti-nausea medication and some antibiotics to help fight the illness. Also, since the puppy is dehydrated, IV fluids will need to be administered so they are able to become hydrated again. If the puppy has been losing a lot of blood through the diarrhea, then a blood transfusion may need to be done.
Hello, Karen. We have the results for Joey.
Okay.
Unfortunately, Joey does have parvovirus. We do have a treatment plan put in place and an estimate all made up for you.
This is the estimate. It is the breakdown of the potential cost of Joey's visit. It is broken down under general descriptions with the average cost. The estimate does not go into as much detail as the invoice will. Hello. Hi, Karen. Welcome back. Joey's all ready to go home. He's doing great and recovering nicely. I've got all your treatment information here with the instructions and the estimate. The vet will be out soon to go over the instructions with you.
Thank you so much.
No problem. You can have a seat if you'd like. I'll go fetch Joey for you.
This is the discharge information. This is instructions on how the next couple days should go for Joey. It explains that Joey needs to be given the anti-nausea medication once a day and the antibiotics need to be given twice a day. It also explains that Joey needs to eat small amounts of food for the next week. If anything is to change or get worse, Karen is to give us a call.
This is the invoice. This is the final receipt for the client breaking down all the costs of the patient's visit. It compiles all the costs of the medication and treatments used on Joey. It includes the overnight stay and the initial exam.